So good morning everybody. So yesterday's topics have you read? So many important things are there in yesterday's topics. Okay? Intrinsic factor, short note, then vitamin B12, absorption and transport, short note. Then if pernicious anemia may come, everything will be like vitamin B12 except the cause. Okay, here there is autoimmune destruction of the parietal cells in pernicious anemia. Okay, so there is absence of intrinsic factor, and associated with that there is achlorhydria, absence of hydrochloric acid in the stomach. So that 2-3 things it will be added in the pernicious anemia. Rest of the things are same, like vitamin B12 deficiency, megaloblastic anemia. Okay. Now let's proceed to the next vitamin, vitamin C, very important vitamin. And this vitamin C, as like of other vitamins, cannot be synthesized in the body. That's why it has to be supplied in the diet. Its structure is like that of hexose, like monophosphate, like glucose. No? So, and its acidic property is due to the anolic hydroxyl group. It has an anolic hydroxyl group in its structure. In plasma and tissue, it remains in reduced form. So, vitamin C, another name is ascorbic acid. It is water soluble and essential vitamin, structurally similar to the hexose. It is found in two forms in the body, D-ascorbic acid and L-ascorbic acid. While we studied monosaccharide, we discussed about isomerism. Okay, in isomerism there is D and L form, capital D and capital L form of monosaccharide, no, glucose. Like that, here also there is two forms, D-ascorbic acid and L-ascorbic acid. However, L-ascorbic acid it remains in active form, and if D-ascorbic acid has no activity in the body, and it is a strongly reducing agent because of its anol group. It is strongly reducing. We have stressed it in this property, reducing property, because in the practical or in the clinics, bedside clinics, when you test urine for presence of sugar is also reducing as agent because of its free aldehyde group in carbon number 1. Okay, now in reducing, in the Benedict solution, it forms anadiol, and that gives the reducing property. Okay, now when you test, you get the reducing test positive. There is the presence of reducing reducing agent in the Benedict test. Now this vitamin C also, as it is strongly reducing, its presence will give Benedict test positive. Now you have to see whether this Benedict test of that patient is because of this ascorbic acid or because of the glucose. Because ascorbic acid is excreted in the urine as it is, without any change and with some change also. In 2,3-diketogulonic acid, it is gulonic acid. So this is also excreted from acetol. In this form also it is excreted, and also excreted as ascorbic acid. So you have to ask whether he is taking any sour things such as food in plenty or not. Okay. Now, L-ascorbic acid, it is oxidized to dehydroascorbic acid. And further, the dehydroascorbic acid is hydrated to form 2,3-diketogulonic acid, and it is converted into oxalic acid. It is excreted as majority of the ascorbic acid is excreted as oxalic acid and some amount of ascorbic acid itself. Biologically active form is L-Ascorbic acid and dehydroascorbic acid. When it acts as antioxidant, it gets oxidized to dehydroascorbic acid. Again, it is interconvertible and it again converted into ascorbic acid and taking the reaction as fresh. Vitamin C is essential because it can be synthesized from glucose. From glucose, gluconic acid. Gluconic acid again is important for our glucuronic acid is very important for our body because of the detoxification or elimination of the those respiratory product by conjugation. For conjugation reaction, gluconic acid is required. From gluconic acid, it can be converted into gulonic acid. Now, this gulonic acid can be converted into ascorbic acid by the enzyme Gulonolactone Oxidase. Remember the name of the enzyme. Okay. Higher primates and human cannot synthesize ascorbic acid in their body. Explain why. There will be a question. So, remember the enzyme. You have to mention the name of the enzyme, and it is absent in human being and higher animal primates. Like that's why it cannot synthesize, and in lower animal it is present, so they can synthesize ascorbic acid. Now, once the gluonate is formed, in higher animals, from gluonate, L-xylose is synthesized, xylitol, and then D-xylose phosphate is synthesized. That enters in HMP pathway. HMP pathway, you will know it when we read this. When you read glucose metabolism, carbohydrate metabolism. Dietary source, the rich source is Indian gooseberry. Amla is a very good source, has a good source of high content of ascorbic acid. Then orange, lemon, cabbage, guava is a very good source. Okay, mango, cauliflower. Okay, then tomato is again very good source. Then potato, especially potato skins. So those things are very good source of ascorbic acid. Daily recommended dose is 60 to 75 milligram per day. In pregnancy and lactation or in old age, it should be more about 100 milligram per day. In the body, highest concentration of vitamin C is found in the adrenal gland and gonad. Biochemical function, it has a great role in collagen formation, iron absorption and hemoglobin metabolism, enzymatic function, then antioxidant property, bile acid synthesis, immunological and cellular respiration. Can you see backside? Okay. Now let's see one by one. In case of collagen formation, it starts as a pre-pro-collagen. Pre-pro-collagen. Synthesis of collagen starts as pre-pro-collagen, then from the pro-collagen. In pro-collagen, it is nothing but a peptide chain. It contains amino acid proline and hydroxyproline. Okay, listen it will be there in the exam. So there will be proline and hydroxyproline amino acids. Now these two amino acids are hydroxylated to hydroxyproline and hydroxylysine. Proline and lysine is further hydroxylated to hydroxyproline and hydroxylysine. This is essential in case of procollagen because it provides cross-linking of the collagen fiber. Cross-linking of the collagen fiber. Okay? And cross-linking of collagen fiber is required for the strength of the collagen. See, here you have the Achilles tendon. If you find it is very strong, the whole body, when you jump, the weight of the whole body, it can easily bear. Okay, so how much strong it should be. So that strength is provided by the cross-linking of the collagen. Now, consider your vessel. Consider the pressure inside the vessel. Now, vessel wall, if it is not strong, then it will rupture. No? That's what happens in the old age. That's why old age, the dose is a bit more. That's what happens in old age, and there is rupture of vessels, and they get ecchymosis, black spots. Okay? Sometimes it causes bleeding inside the brain. Understand? So it is so much important, this hydroxylation reaction of the collagen fiber. So from that, the collagen is synthesized, and it is the reaction responsible for providing strength of the collagen. The proline is converted into hydroxyproline by the enzyme prolyl hydroxylase. Here, the role of ascorbic acid is here. This prolyl hydroxyl has iron as metal. Okay. Now, during the period of reaction, this ferrous ion is converted into ferric ion. Ferrous is converted into ferric ion. Now, to take part in the reaction, again ferric ion has to be reduced to ferrous ion. That part is done by the ascorbic acid. Ascorbic acid, it reduces ferric ion to ferrous ion. Okay. Now it becomes the dihydroascorbate, and it is reversible reaction. So this is a reversible reaction. So they can interchange each other. Iron absorption, it plays an important role in absorption of the iron. In the food particle, iron remains as ferric form. To get absorbed, whenever iron wants to cross the cell membrane, it has to be in ferrous form. It cannot enter or cannot go out of the cell in ferric form. So it has to be in ferrous form. It is the vitamin C that converts this ferric form of the dietary iron into ferrous form. Then only it can be absorbed. Again, this ferrous form of iron is very reactive. Okay? When it enters in the cell, immediately it has to be converted into ferric form. Otherwise, it will start oxidizing the biomolecule. So when it enters in the cell, it is again oxidized to ferric form. Here also we need vitamin C. Okay? Now, as ferric form, it is stored in the body as ferritin. Whenever iron is required for the body, ferritin provides iron as ferrous form, and here again vitamin C is required. So vitamin C is very important for absorption of the iron and for making the iron ferric to ferrous during the biochemical reaction. It is helpful in converting the mat hemoglobin to hemoglobin. Then folic acid to convert it into its active form, tetrahydrofolate. Both vitamin C and tetrahydrofolate is responsible for maturation of the erythrocyte and erythropoiesis. Enzymatic function in adrenal gland, it helps in synthesizing corticosteroid hormones In case of copper containing enzyme like dopamine to norepinephrine, para-hydroxyphenyl pyruvate to homogentic acid, this is the step where catecholamine synthesis occurs, and in this step is required in the tyrosine metabolism. So these reactions, the cupric ion, in this reaction the cuprous ion is converted into cupric ion. So vitamin C is required to re-establish this cupric ion to cuprous form, so that enzyme can further take part in a new reaction. That also same thing is in enzyme containing iron. Explanation is same. Serotonin synthesis tryptophan to 5-hydroxytryptophan, collagen synthesis, in collagen synthesis proline to hydroxyproline. So these are the enzymatic reactions require vitamin C. Now biochemical function in regard to the antioxidant. The natural antioxidant very highly responsible for body antioxidant function. Now we have cell membrane. Cell membrane has polyunsaturated fatty acid. PUFA means polyunsaturated fatty acid. Cell is having polyunsaturated fatty acid in phospholipid. We have lipid bilayer membrane in the cell. No? So in cell, lipid bilayer membrane. This one is straight saturated fatty acid, another is polyunsaturated fatty acid containing polyunsaturated fatty acid. The kink is provided by the polyunsaturated fatty acid. Kink. Unsaturation is unsaturation in the chain of fatty acid provides kink. If this kink is oxidized, it becomes straight. So the fluidity of the membrane is lost. That's why it is very important to keep the PUFA protected. Now here the R is the reactive species, free radical. We denote it like that, R. Now it is very strong oxidizing agent. It will start oxidizing the unsaturated bond of the PUFA and convert this PUFA into lipid peroxyradical. PUFA is converted by the free radical into lipid peroxyradical. Lipid peroxyradical also again offending agent for the cell membrane. It will go on oxidizing the other PUFAs. Okay, it becomes again the offending agent for the membrane. So if it is not converted into non-toxic form, then it will go on, carry on the oxidizing the unsaturated bond of other PUFAs newly. There will be a chain reaction rather. There is a chain reaction of free radical, and responsible free radical is this lipid peroxyradical. So this is done, this is protected by the another vitamin, that is tocopherol. Tocopherol, vitamin E. This one will receive this free radical electron from the PUFA and get oxidized to phenoxyradical. Phenoxyradical. This is not that type of offending. So this one will be converted, this polyunsaturated fatty acid, free lipid peroxyradical will be converted into hydroperoxyradical. Though it is radical, but it is not offending. There is no dot. See, the dot is there. There is no dot. So it is not offending agent. Now we need to regenerate this vitamin E. Now this phenoxyradical is immediately reduced by vitamin C. By reduced vitamin C, and vitamin C itself gets oxidized. Okay. Now this oxidized vitamin has to be regenerated, and that is done by the glutathione peroxidase. enzyme glutathione peroxidase, and the molecule is glutathione. This is reduced glutathione. This will accept the electron, and vitamin C will be reduced, and glutathione itself is getting oxidized. So regeneration of glutathione oxidase is further done by the NADPH. NADPH will convert this reduced glutathione to oxidized glutathione to reduced glutathione. Okay, this is a chain reaction, very important reaction. You will get in vitamin E also, you will get in this free radical metabolism also. This part you understood, no? Then vitamin C is important for 7-hydroxylase enzyme reaction in the cholesterol pathway during the bile acid synthesis. Then synthesis of immunoglobulins, phagocytic action of the leukocytes, all are helped by the vitamin C. It is essential for the electron transport chain also. In its presence, the optimal activity of the cytochrome oxidase is found. So vitamin C, it is required in all these cases. Now deficiency. The disease which is produced by deficiency of vitamin C is called scurvy. Scurvy, it is hemorrhagic tendency occurs under minor trauma or spontaneously. In case of scurvy, there will be gum bleeding. When people brush in the morning, automatically there will be bleeding from the gum. Now, it may be due to injury also. If your brush is hurt, it may be due to the vitamin C also, deficiency. But in vitamin deficiency, other signs will be there. There are swollen gums will be there, painful gums will be there. Okay, so those things will be there. So, in case of vitamin C deficiency, the gums will be swollen, painful, spongy, bleeds on slight pressure. Okay, this is called Scorbutic Gingivitis. Scorbutic Gingivitis. Inflammation of the gum is termed as gingivitis. And in the other parts of the body, subcutaneous and oral mucous membrane hemorrhage will be there because there is malformation of the extracellular matrix where collagen is there. So collagen malformation means there is weak extracellular matrix, and extracellular matrix is there in the vascular wall. So when you just press like that, there will be tear and torn of the arterioles, and there will be bleeding under the skin. So and so also mucous membrane. There will be petechial hemorrhage, ecchymosis and hematoma. Petechial hemorrhage means small pinhead like red spots due to bleeding. Okay. Now, if a mosquito bites, if there is a red spot is there, that is not petechial hemorrhage. Okay, there will be multiple small pinhead like bleeding spots under the skin. Ecchymosis means when it is a bit bigger. When this much big area becomes dark, black, it is called ecchymosis. And hematoma means there is huge collection of blood underneath the skin or in the tissue. Okay. The difference is the amount of blood. Internal bleeding, there may be epistaxis, bleeding from the nose. There will be, without any reason, there will be bleeding from the nose. Not without reason, there will be without any injury, I should say. There is no pricking, nothing is there, but there will be bleeding. Spontaneous bleeding will be there because the nasal septum has a plexus of arterioles, and that gets ruptured, easily ruptured in case of vitamin C deficiency. Hematuria, passing of blood in the urine. Melena, blood in stool. This melena blood will be black. Okay. Usually in the upper GI, melena occurs, and upper GI we have hydrochloric acid also. So there will be formation of acid hematine. That's why it becomes black. Okay. But in case of say dysentery, you have this one, bleed blood in the stool. No? In case of piles, you have blood in the stool. Those are fresh blood. These are not dark. These are fresh blood. So melena is not the fresh blood. Melena is the dark color or black stool due to acid hematine in the blood. Now, along with these symptoms, skin changes. There are other skin changes. Skin will be dry, rough, pigmented skin. Perifollicular hyperkeratosis will be there. The skin have this hair, no? Hair follicles. So, margin of the hair follicle, it becomes a bit rough type, elevated. So, skin will not be smooth. We used to speak, no? Take gooseberry or lemon in the early morning and plenty, and your skin will become good looking. Okay. So, it is because of this only. In the deficiency of vitamin C, the skin will be rough looking. Here, the spots will be there. These are not the bleeding spots. These are the elevated hyperkeratotic areas. Then skeletal changes due to the abnormal collagen formation. There will be weak bones. It can fracture easily. It can break easily. Subperiosteal bleeding underneath in the bone. Outer covering of the is called periosteum. A covering is there in the bone, outside the bone. It is called periosteum. So underneath the periosteum, there will be bleeding because of abnormal collagen formation. Then hemorrhage in the joint cavity, painful swelling of the joints, delayed wound healing. See, when we stand, the 50 kg weight is borne by the knee, no? And when we do like that, a lot of pressure is there in the elbow. So there is a friction in the bones, in the knee joint or big joints. So once there is friction, once there is weak collagen, there will be injury in the tissue and there will be bleeding. So there will be joint swelling, then bleeding in the joint cavity. Delayed wound healing, when there is cut, the healing occurs by means of fibrosis. Fibrosis is nothing but for collagen tissue. So once there is vitamin C is deficient, there is less formation of collagen, so there will be delayed wound healing. The wound healing will take long time. Loss of blood by hemorrhagic tendency, absorption and storage of iron, decreased absorption and storage of iron, altered folic acid metabolism, accumulation of methemoglobin in erythrocyte. These all will be leading to anemia. The anemia is microcytic hypochromic type of anemia, hypochromic because of the inadequate iron. There is synchron, yes sir. What happened? So once there is less iron absorption, there will be less hemoglobin formation. So RBC will have less amount of hemoglobin. Okay. There is different size of RBC will be there, and RBC, this is poikilocytosis. Anisocytosis means one RBC is small, one is big. There is difference in shape of the RBC. That is anisocytosis. Assessment is done by clinical tourniquet test. If you apply the blood pressure cuff in the arm and raise the pressure and keep for some time, there will be petechial hemorrhage in the skin. That is capillary fragility test. Then serum assay can be done. Then high performance liquid chromatography can be done. By this, the amount of vitamin C is estimated. Vitamin C therapeutic use, adjuvant treatment for infection. It is thought that in cough and cold, if lot of vitamins are taken, it gets treated very early. But there is no proof. That's why, but still this practice is there. When there is cough and cold, we advise them to take vitamin C. Okay. Now, maybe indirectly it is helping by antioxidant function. During the last COVID, you know, you are aware of the COVID, Corona. During Corona, we supplied so much vitamin to the patients. We used to give, because Corona is a viral disease, you know, nothing can be done. No treatment is there. So we try to build up the immunity. There is a point is there. It helps in increasing the immunity of the body. No? So we give vitamin C, let their own immunity gets built up and let them fight themselves against the corona. That was the idea. I think it was, it had some role also. Treatment of ulcer, trauma, burns. Previously we used to give whenever there is a burn patient comes or whenever there is wound patient comes, we used to give say 20 days or 30 days course of vitamin C. Okay, but nowadays people are very conscious, they know what is the vitamin. Students, they learn from their lower classes the vitamins and role of vitamins. So they are very conscious about vitamin, and people also and guardians also, they are conscious. They are providing their child with good vitamins, so we don't have to worry for that. But during our time there was poverty. People were very poor in villages. When they come, we had to supplement, give supplement. Treatment of common cold, hypercholesterolemia, diabetes mellitus, hypertension, stroke, Alzheimer's disease. Alzheimer's disease is a kind of forgetfulness. The old days people, what they do, they forget even their name. If you ask them, he will just sit idle in the somewhere. If his son comes, Baba, do you know me? Vacantly he will give, no? Then once he go out, he can't remember where is his home. So if somebody asks, what is your name? He will do like that. He cannot understand the thing and cannot reply. So that is Alzheimer's disease. This is very common problem nowadays. So there we give vitamin C just to help them with the antioxidant property of the vitamin C, so that there is no oxidation of brain matter, and that is prevented. In hypercholesterolemia, diabetes mellitus, hypertension, stroke, this exposure to free radical is one of the cause of this disease. So we give antioxidant so that his body normally can utilize the free radicals. So here is a case study. A 6-year-old baby was brought to the hospital with complaints of painful and bleeding gums. On examination, petechiae were seen, joints were swollen and painful, capillary fragility test was positive, iron deficiency anemia was present. What is the probable diagnosis? Okay, we know it is vitamin C deficiency leading to scurvy. Mention the cause of the condition. It is vitamin C. This most common cause is vitamin C deficiency. Describe the function of deficient molecule. So you have to describe the functions of deficient molecule is vitamin C. Explain the biochemical basis of clinical feature. Explain the biochemical basis of clinical feature. It is not that you will find out the clinical feature here and write down this thing, petechial hemorrhage, joint swelling, these things. No. You have to explain why it is. Okay. Now, so many points are there. Painful and bleeding gums. So you have to tell why painful bleeding gum is there. Petechiae or sin, petechiae. What is the reason of petechiae? You have to tell. Joints are swollen and painful. You have to explain. Capillary fragility was positive. Why? Iron deficiency anemia was present. Why? These are the points. See, I have given 7 questions. When you get the question, there will not be 7. There will be hardly 4. Okay, or 3. So you have to give the reason of this disorder. Now, what is the probable diagnosis? Justify your diagnosis. Say this is a case of scurvy because there was painful and bleeding gums. Then petechial hemorrhage is there. Swollen painful joints are there, and there was positive capillary fragility test along with deficiency of iron deficiency anemia. So these suggest that there is most probably their cause is vitamin deficiency. So this is the justification. Justification part you have to give from the statement. Okay. Now explain the clinical biochemical basis of the clinical feature. That you have to explain those justifications biochemically. You have to explain. Okay. Sometimes they put short note. Okay. These are choline, inositol, lipoic acid, PABA, and bioflavonoids. So choline is trimethyl hydroxyethanolamine. This is the structure. It can be synthesized in the body from serine. It is also available from many dietary sources like milk, egg, liver, cereals. Previously, radiolabeled choline is used in medical imaging. Imaging means during the time of, say, special type of X-ray, then CT scan, those things. Choline is as a component of phospholipid, lecithin is involved in membrane structure and lipid transport. So you are taught phospholipid, no? Lipid chemistry. Phospholipid is very important. You may get long question, you may get short one. So phospholipids you read nicely. So choline, it takes part in membrane structure formation. Choline prevents the accumulation of fat in liver as lipotropic factor. Lipotropic factors means those agents which remove fat from the liver. Now, some of you might have seen the sonography of some patient or your near relative. There it is written fatty liver. Fatty liver. Okay, whenever you do sonography, you will find that at least 90% sonography says there is fatty liver. Nowadays, people, they are fond of taking food from the restaurant and all these things, fast food, and lot of oils are there. That get deposited in the liver. That causes fatty liver. So choline, it is one agent that removes fat from the liver. Okay, so that is those factors which chemicals which remove fat from the liver are called lipotropic factor. You may be given as lipotropic factor also. In that case, choline and inositol you have to describe. Then it promotes synthesis of phospholipids and lipoproteins and the disposal of triacyl glycerol from the liver. The oil you are taking is nothing but the triacyl glycerol. Okay, so it gets deposited in the liver, so it will remove this triacyl glycerol. Due to presence of 3 methyl group, 1 carbon fragment. Methyl group is a 1 carbon fragment. So it will serve as, it is involved in 1 carbon metabolism also. Choline is a precursor for the synthesis of acetylcholine. In acetylcholine, choline is there, so naturally choline is taking part in acetylcholine synthesis, which is required for transmission of nerve impulse. Acetylcholine is a neurotransmitter. Okay, so it takes part in nerve impulse transmission. Choline an essential nutrient is choline an essential nutrient? Yes. Some of the workers, they label choline as essential dietary nutrient with the RDA range from 400 to 500 milligram. However, human being can synthesize. If no other reason for not synthesizing choline is there, then choline is adequately synthesized in the body, and in some cases this may be insufficient to meet the body need. Inositol, also known as myoinositol or mesoinositol, biochemical functions required for synthesis of phosphatidyl inositol. Phosphatidyl inositol, a constituent of cell membrane. You will know very frequently when you go for next topics, signal transmission or mechanism of hormone action mechanism. Okay, so in that case, this then you will come to know how it is helping in transmission of the signal, being a component of cell membrane. It acts as lipotropic factor. For some hormone, inositol acts as second messenger at the membrane level for the release of calcium ion. Okay, the hormone, it binds to the receptor in the cell membrane. It sends this inositol towards the calcium channel, and there it increases the release of calcium ion. Phytin is a hexaphosphate of inositol found in the plant. It prevents the absorption of iron and calcium from the intestine. Okay. Phytin or phytic acid also, same thing. What happens? It binds with the calcium and form an insoluble compound, calcium phytate or ferrous phytate, that retards the absorption of calcium or iron. So it should not be taken together. Okay. Say one example is your maize, corn, that contains high level of phytate. So when you take maize or corn, do not take milk along with that. Otherwise, your calcium from milk will not be absorbed adequately. Inositol is used in the treatment of polycystic ovarian syndrome. It helps increasing the insulin sensitivity, which improves ovarian function. Lipoic acid, and regarding this, lipoic acid, it is also called thioptic acid, is a sulfur containing fatty acid. It exists in an oxidized and reduced form in the body. Lipoic acid is fat as well as water soluble. It acts like a coenzyme. We have pyruvate dehydrogenase, alpha-ketoglutarate dehydrogenase. These enzymes use 5 coenzymes, and one of the coenzymes is lipoic acid. Okay, so it takes part, it helps those reactions also. Biochemical function, lipoic acid is involved in the decarboxylation reaction along with other vitamins, thiamine, niacin, riboflavin and pantothenic acid. The conversion of pyruvate to acetyl-CoA by the pyruvate dehydrogenase, alpha-ketoglutarate and alpha-ketoglutarate to succinyl-CoA by alpha-ketoglutarate dehydrogenase require lipoic acid. Therapeutic use of lipoic acid. In recent years, administration of high dose of lipoic acid or dihydrolipoic acid is gaining importance. It is regarded as universal antioxidant. It functions as antioxidant. Reduce the free radical in brain. Otherwise contributes to Alzheimer's disease and multiple sclerosis. See, Alzheimer's disease and multiple sclerosis, they are cause of the disease is taken as that free radical action. So lipoic acid, it can neutralize the free radical, and that's why in Alzheimer's disease and multiple sclerosis it is given. As it is fat soluble, it can easily go to the brain. Stimulate producing glutathione, recyclic vitamin E and C. Glutathione, vitamin E and C, all are antioxidants only. Okay, so it helps in regenerating those antioxidants. Reduce insulin resistance, reduce plasma LDL, prevent stroke and MI. All are related to antioxidant activity. Para-aminobenzoic acid, it is a component of the folic acid. So deficiency is associated with failure of lactation, graying of black hair in rat. It is in rat, but it is not proved in human. Essential for bacterial growth. Now, this para-aminobenzoic acid is structurally similar to the sulfonamide. That's why sulfonamide, it competitively attaches with this steroic acid, so that the abnormal molecule is formed instead of folic acid. That's why it becomes a bacteriostatic drug. In case of bacteria, when you give this drug, the bacterial growth is inhibited. Bacteriostatic means growth of bacteria is, multiplication of bacteria is inhibited due to lack of folic acid. Bioflavonoids isolated from lemon peels found responsible for maintenance of normal capillary permeability, acts as an antioxidant, protects vitamin C from being destroyed, have been used to correct vascular permeability. Now, these bioflavonoids, they are nowadays used for many diseases like perimenopausal syndrome. At the age of 45 to 50, the menstrual cycle of female stops. So starting from 1 year, 2 years earlier or 2 or 3 years after stopping, this period is called perimenopausal period. And during that period, the lady will have hot flash, burning sensation. Okay. Now these things are said to be prevented by these bioflavonoids, and they are given along with calcium to combat these symptoms. So this what I told you about hot flash, then sweaty things, face, burning type of, tingling type of sensation. These are due to the vasodilatation. There is change because of the change in vascular permeability. So it is given to prevent those things. Sources: peel, pulp of citrus fruit, cabbage, and vegetables also it is there. So this is some of the that vitamin-like compound, and they are required for different body reactions, preventing the diseases, then protecting the antioxidants. Just read something, sometimes it comes, so that you do not have to miss the question. So we will stop here today.